Good afternoon. Am I audible? If I'm audible, can I see a thumbs up, please? So, if you're joining the session for the first time, this is Dr. Shanmugapriya. I'm professor and head of the Department of Biochemistry at Government Thuthukudi Medical College. And I'm your Unacademy educator for Biochemistry. And as you know, this is a NEET PG 2022 Biochemistry recall. So I have around 17 questions, and I will be telling you the key for all those 17 questions, and I will also be giving you a relevant explanation for the same. Okay. So before we start the session, let me tell you a few facts about Unacademy plans. So on Unacademy, we have plus subscription and iconic subscription. Plus subscription gives you access to I'm Good Bio Ninja. Thank you. So plus subscription gives you access to both live and recorded sessions. It also gives you access to a question bank with 25,000 plus clinical case-based MCQs. And all these MCQs are framed based on the latest pattern. An iconic subscription gives you access to both Unacademy and Preplada platform. So if you have either plus subscription or iconic subscription, then you will be able to access multiple structured courses which are happening on this platform. For example, currently we have a crash course on mnemonics which is conducted by Dr. Nikita Nanwani, and it started on May 19th, and the duration of this course will be for 10 days, wherein rapid revision of all mnemonics will be done. And we also have light subscription, and light subscription will give you an access to all practice tests and grant tests. And not just that, if you have light subscription, iconic subscription or plus subscription, you will be able to access the previous year question bank section, and this section can be accessed through self-study practice section. And this section includes the last 4-year question papers of NEET PG, FMG as well as INA CET. And for every question, a detailed explanation is also provided, so that will help you in the last lab preparation for any of your competitive or clearance exam. And in all these plus classes, there is we also have auto daily practice papers. So if you practice those papers, you will clearly understand which part of the topic you have understood and which part of the topic or which concept you are not very clear about, which you can get clarified through educators. And currently we have a batch for UPSC CMS revision, and this is in the pre-launch phase, and so we have a pre-launch offer which is 2,475. And this batch is starting on May 23rd, and the duration of this course would be 1.5 months. And in this course, OBG, pediatrics, surgery, medicine and SPM will be covered. And we also have an MBBS Prof 1 course, and in this course, anatomy, physiology, biochemistry, all 3 subjects will be discussed in detail, and all these 3 subjects will be aligned and will be integrated clinically. Guidance will also be provided about regarding Viva and practicals. So if you know any of your juniors who's looking for a guidance for preparing for their first MBBS university exam, you can definitely recommend this course. And apart from this, we have multiple free tests, not only for subscribers, we have multiple free tests which are happening. Good afternoon, Srizana. So I can see that you're all relaxed. So this is the free test calendar for this month, wherein multiple subjects, the corresponding educators will be curating the test series for you. And if you attempt these tests, again you will understand where you stand and what you need to concentrate on. And to enroll yourself for all these practice tests, you can use my code, which is C Shanmugapriya. My name is C Shanmugapriya. And this is the current NEET PG subscription plan. So if you want a plus subscription, the minimum duration that you can opt for is 3 months. That would cost you 10,000. Iconic subscription minimum is 6 months. That would cost you 32,000. Light subscription minimum is 1 month. That would cost you 960 rupees. And for MBBS Prof 1 course, the minimum duration is 3 months. That would cost you 4,400. And all these costs are inclusive of 20% discount offer. And to avail this 20% discount, you can use my code C Shanmugapriya. So that's all about Unacademy's plans. Let's now start discussing the NEET PG 2022 questions. So I know you're all relaxed post PG 2022 because the feedback that I've been receiving from all students is it's a mixed reaction that I've been seeing. So most of the questions were, all the questions were from familiar topics. There were no completely new topic. It was not an unprecedented paper as which happened in INICET. So familiar topics, familiar questions, only choices were a bit dicey. So most of you were able to exclude 2 choices and you got stuck in the last 2 choices, which means you have done your preparation well. Yeah, only those who have done the preparation well would give this feedback. So the last 2 choices alone were very difficult. Otherwise, the question paper was a bit on the moderate side, right? So, and as far as biochemistry is concerned, all the topics, every question that was asked in the NEET PG 2022 were already discussed on Unacademy. So let's try to find out the key for all these questions. Currently today I have 17 questions. So usually they say biochemistry there will be 10 or less than 10, right? So this time I found 17 questions based on the topics that were covered in our classes. So this is the first question. Image was not given, only history. Okay. So probably cherry red spot was given, right? Okay. So if it's cherry red spot, and what is the summary? You got stuck like that, which means you have prepared well, Srizana. Don't worry, you will get a good rank. So the history says there is difficulty in breathing while running, unable to rise from squatting position, which means the child is presenting with neurological manifestations. Neurological manifestations with cherry red spot. What is your diagnosis? So cherry red spot will give you a clue. It is Tay Sachs disease, right? It is Tay Sachs disease, which is otherwise called as GM2 gangliosidosis. It's otherwise called as GM2 gangliosidosis. And in GM2 gangliosidosis, classically you will find neurological manifestations without systemic manifestations. You will not find hepatosplenomegaly, neurological manifestation with cherry red spot. And just because cherry red spot is provided, you can exclude other choices. Because I've told you in the class that there is no cherry red spot in KGF. Yeah, for all movie interests, yeah, for all those who have movie interests, you know, KGF is Cola Gold, something like that, right? So KGF, but for us medicos, it is KGF can be abbreviated as Krabbe's disease, Gaucher's disease, and Fabry's disease. So Krabbe's, Gaucher's, and Fabry's, Kolar Goldfield, yeah, that is movie. So here it is Krabbe's disease, Gaucher's disease, and Fabry's disease, no cherry red spot. So what is the right answer here? The right answer here is Tay Sachs. Yeah, that's what I saw. So for a better understanding of what is cherry red spot is nothing but a relative prominence. What you see here is a relative prominence of phobia, right? So in cherry red spot, it is nothing but a brighter phobia when compared to the translucent surrounding. So macula has got a phobia. Phobia does not have ganglion cells. So whenever there is a lipid storage disorder, only ganglion cells will accumulate these lipids. So surrounding region will be translucent, whereas the phobia alone, which does not have ganglion cells, will be brighter. So that is the reason for cherry red spot, which is seen in all lipid storage disorders. Now the next question is, a child presents with anemia, thrombocytopenia. On examination, hepatosplenomegaly is observed. The child also complains of bony pain. Light microscopy reveals crumpled tissue paper appearance. So this is the key word, right? This is the key phrase that is provided to you. Whenever you see crumpled tissue paper appearance on light microscopy, what will be your diagnosis? Your diagnosis will be Gaucher's disease, right? And what is the enzyme which is defective in Gaucher's disease? It is beta-glucosidase. So what is the answer for this question? Answer for this question is beta-glucosidase, because whenever beta-glucosidase is defective, what accumulates? Very good. What accumulates? It is glucosyl ceramide which accumulates. And this glucosyl ceramide is a normal or inherent property of membranes present in blood cells. For example, RBCs and platelets normally have glucosyl ceramide that gets normally metabolized by beta-glucosidase. So when that enzyme is defective in RBC membrane and platelet membrane, this glucosyl ceramides accumulate. So abnormal structure of the membrane will push these RBCs and platelets to be engulfed by macrophages. and that is why there is hemolysis causing anemia and thrombocytopenia. And when macrophages engulf these glucosyl ceramide containing membrane, those membranes will accumulate inside macrophages as fibrils. So those fibrils of macrophages is what you see on light microscopy as crumpled tissue paper appearance. So crumpled tissue paper appearance, yes, I am explaining everything. What is it? Yeah, so this is about tissue paper appearance that is seen in Gaucher's disease. Yeah, glucosyl cerebroside. Very good. So if that is given, then the answer is straight away, it is beta glucosidase defect. Now for completion's sake, what is alpha glucosidase defect? Alpha glucosidase or acid maltase defect. Glucosyl cerebroside. Okay. Glucosyl cerebrosidase defect. Okay. So alpha glucosidase defect is acid maltase defect is nothing but Pompey's disease. Yeah, what is it? It is Pompey's disease. And then alpha galactosidase defect causes which disease? Fabry's disease. Alpha galactosidase defect causes Fabry's disease. Beta galactosidase defect causes which condition? This is GM1 gangliosidosis. Yeah, GM1 gangliosidosis. So Gaucher's disease is caused by the defect of beta glucosyl ceramidase. Do you understand this? It is beta glucosyl ceramidase defect causes Gaucher's. Alpha glucosidase defect causes Pompey's. Alpha galactosidase defect causes Fabry's. And Fabry's will present with angiokeratomas. There was nothing mentioned about angiokeratomas in the question. Okay. And had it been GM1 gangliosidosis, apart from hepatosplenomegaly, it would have presented with neurological manifestations. You know that, right? GM2 gangliosidosis, not only hepatosplenomegaly, there will also be neurological manifestations, and that does not present with crumpled tissue paper appearance. So answer for this question is beta glucosyl ceramidase. So there were many questions on vitamins, and all these questions, exactly these questions we had already discussed, right? I gave you history, a case-based MCQ wherein I told you INH, a patient is on INH presenting with neuropathy. So which vitamin deficiency will cause neuropathy? It is vitamin B6. Why vitamin B6 deficiency in isoniazide treatment? Because isoniazide is a structural analog of pyridoxal. It's a structural analog of pyridoxal. So instead of pyridoxal being acted upon by pyridoxal kinase, INH will be acted upon by pyridoxal kinase. So it is a competitive inhibitor of pyridoxal kinase. Yes, the answer is vitamin B6. So when pyridoxal kinase is inhibited, the person will not get the active form of vitamin B6, which is pyridoxal phosphate. And without pyridoxal phosphate, there will be neuropathy, because pyridoxal phosphate is necessary for multiple enzymes which are involved in neurotransmitter synthesis. So B6 deficiency will cause neuropathy. So INH treatment causes B6 deficiency because it inhibits pyridoxal kinase. So the active form of PLP, the active form of pyridoxal or pyridoxal phosphate cannot be synthesized. Okay. And this could be the most simplest question, right? The most simple question ever that you would have come across. Which of the following vitamin deficiencies is peripheral neuropathy? Which of the following vitamin deficiency causes the condition that is shown in the image? So what do you see in the image? Bitot spots. So what are bitot spots? They are well circumscribed. Yeah, they are well circumscribed, whitish or grayish, foamy structure which is present on the temporal limbus. Mostly present on the temporal limbus. Mostly it is bilateral. And it is caused by which vitamin deficiency? Yes, vitamin A deficiency. And what is the reason for vitamin A deficiency presenting with bitot spots? It is because retinoic acid, retinoic acid suppresses keratinization of epithelium. Retinoic acid suppresses keratinization of epithelium. So in vitamin A deficiency, conjunctival epithelium undergoes keratinization. And what is bitot spot? It is nothing but keratin debris. Yeah, Bitot spot is nothing but keratin debris caused by vitamin A deficiency. Yes. Which of the following enzyme activities can be estimated in RBCs to diagnose vitamin B2 deficiency? So riboflavin, FAD or riboflavin deficiency, this I've given you a tip to remember. What is the tip I told you? Riboflavin is ribbon, yeah, glue. So I told you ribbon and glue go hand in hand as far as craft work is concerned. Do you remember that? Ribbon and glue go hand in hand as far as craft work is concerned. So whenever you suspect riboflavin deficiency, glue. What is glue? Glutathione reductase enzyme activity. Gaurav, it is not transketolase. B2 deficiency, what will you estimate? It is glutathione reductase activity. Transketolase is for thiamine deficiency. Yes, ribbon and glue. Transketolase is for thiamine deficiency. So out of these enzymes, transketolase and pyruvate dehydrogenase are dependent on thiamine. Kynurenase is dependent on B6. So if you suspect B2 deficiency, undoubtedly it is RBC glutathione reductase activity. A woman on this was also discussed in one of the plus classes. I gave you exactly a similar history. So fat malabsorption. So a woman on antidepressant presents with bleeding. She gives a history of bulky stools which stick to the pan. So some history was provided. I was told that some history was provided for you to think of steatorrhea or fat malabsorption. So what possibly could have been the cause of fat malabsorption? The antidepressant, the woman on antidepressant might have been taking some weight reduction pill, and this weight reduction pill might interfere with fat absorption. So fat malabsorption presenting with bleeding. So what would be the cause? It should be a fat soluble vitamin malabsorption. Which fat soluble vitamin malabsorption can cause bleeding? It is vitamin K. Yeah, you know that vitamin K is necessary as a cofactor. It is necessary as a cofactor for gamma carboxylation of vitamin K dependent clotting factors. What are the vitamin K dependent clotting factors? 2, 7, 9, 10. Okay. Oh, I discussed in USMLE MCQs. Okay. I don't remember exactly when I did it. But we did a session on vitamins also in plus class. That is when I also told you about this clearly. So it is necessary as a cofactor for gamma carboxylase, which is necessary for gamma carboxylation of vitamin K dependent clotting factors 2, 7, 9, 10. So for any reason, if vitamin K is deficient, 2, 7, 9, 10 will not be available. So that causes bleeding. Now why is vitamin K not absorbed in fat malabsorption? Because of the structure. So this vitamin K has got a ring, a complex ring. You don't have to even know the name. It has got a complex ring with a side chain. And the side chain is a polyisoprenoid side chain. And if this polyisoprenoid side chain has got 20 carbon atoms, we call it as vitamin K1. If it has got 30 carbon atoms, it is vitamin K2. So these isoprenoid side chains will make these vitamin K vitamins to be dependent on fat absorption to get absorbed. So whenever there is fat malabsorption, there is vitamin K deficiency. In which case, to avoid vitamin K deficiency, you can give a synthetic analog of vitamin K, which is called as menadione. So what is menadione? In menadione, the side chain is not 20 carbon atom or 30 carbon atom containing isoprenoid side chain, it is just H. So anybody with fat malabsorption, if you don't want the person to present with bleeding, what will you give? You can give menadione, which gets easily absorbed. Even in the absence of bile salts or even in the absence of chylomicron, this can get directly absorbed. Okay, so that's the significance of menadione, a synthetic analog of vitamin K. So I thought you'll be interested in knowing this. You remember my voice in exam, it's like echoing for me. I'm happy, Suzana. I'm happy that it helped. So this is another question. A paint shopkeeper. Paint shopkeeper is a clue that is given to you that the person might suffer from lead poisoning. So lead poisoning presents with anemia. Which of the following enzymes inhibition causes anemia? So lead causing anemia, it should inhibit one of the enzymes of heme synthesis. What is the right answer? The answer is ferrochelatase. Lead inhibits ferrochelatase. Okay, so what are the enzymes of heme synthesis that is inhibited by lead? Not only ferrochelatase, lead inhibits 3 enzymes. The first one is ALA dehydratase. It is not ALA synthase, it is ALA dehydratase, coproporphyrinogen oxidase, and finally ferrochelatase. And of these 3, which is sensitive to inhibition by lead, the first enzyme to be inhibited by lead is ferrochelatase. So when ferrochelatase is inhibited, the precursor, what is the precursor? Protoporphyrin accumulates. And within protoporphyrin, it's the responsibility of ferrochelatase to chelate iron. If iron does not get chelated, instead of that, zinc will get chelated into protoporphyrin. So in lead poisoning, what is the parameter that you will check? It is zinc protoporphyrin levels. Yeah, the sensitive marker for lead poisoning is zinc protoporphyrin levels, which will be elevated. That you can remember to know that the sensitive enzyme, the enzyme which is more sensitive to inhibition by lead is ferrochelatase. Okay. Okay, forensic medicine also discussed. Yes, so going forward, all these subjects will be integrated. So you cannot delineate the question as biochemistry or as pharmacology or as forensic medicine or as general medicine. So most of the questions will be integrated when it comes to next or NEET, and that is why you have to learn it in an integrated fashion. Okay. Now this was another question which must have been discussed in pharmacology session also. Primaquine can precipitate hemolytic anemia in individuals with an enzyme deficiency. The enzyme is related to which pathway? Yeah, so it is HMP shunt. The enzyme is related to HMP shunt. So first tell me, why does primaquine precipitate hemolytic anemia? It precipitates hemolytic anemia only because, yes, answer is C, it is HMP shunt. So why does primaquine precipitate hemolytic anemia? Because primaquine precipitates oxidative stress. And when it precipitates oxidative stress, you know it does not cause hemolysis in every individual. It causes hemolysis only in susceptible individuals who cannot combat this oxidative stress. Yeah, who cannot regenerate glutathione. So glutathione is an important antioxidant mechanism present in RBCs, and those who cannot regenerate glutathione will be susceptible to lysis following intake of primaquine. And for regenerating glutathione, you need NADPH. And this NADPH is generated by G6PD enzyme, which is a part of NADPH is generated by G6PD enzyme, which is a part of which pathway? HMP shunt. Okay, so primaquine precipitates hemolytic anemia only in those individuals who have an enzyme deficiency related to HMP shunt. Exactly, Sridhana. Very good. So I would suggest that you have to learn it in a conceptual way. Yeah, so try to, it's not enough you just remember that primaquine intake will precipitate hemolytic anemia. You should know why does it cause hemolytic anemia. Only then you will be able to relate to the pathway. Okay. Rappaport-Luberin shunt. Okay, good choice that is. Rappaport-Luberin shunt will only give rise to 2,3-BPG. Okay, instead of glycogen metabolism. Thanks for telling me that. Let's have it as Rappaport-Luberin shunt, and that generates only 2,3-BPG. Without 2,3-BPG, what does not happen? Unloading of oxygen does not happen. So it causes only hypoxia. It is not going to cause hemolysis. So this enzyme is related to HMP shunt. Okay. So there is a nucleotide change. Yes, this was discussed in class. So there is a nucleotide change that has resulted in stop codon generation. What is the answer? The answer is nonsense mutation. Okay, this also we have discussed. So whenever there is a nucleotide change, the result can be 3 types of mutation. What are the 3 types of mutation? It can be silent mutation, it can be missense mutation, it can be nonsense mutation. And because of a mutation, if a codon coding for an amino acid is replaced by a codon, it is replaced by another codon which codes for the same amino acid, then that is called a silent mutation. So why is it silent? It is completely silent when you look at the protein. The amino acid sequence remains the same. So based on degeneracy, there can be 2 codons which code for the same amino acid. So that can result in silent mutation. What is missense mutation? A codon coding for one amino acid is replaced by another codon which codes for another amino acid, so that if amino acid sequence is altered, then that is called as missense mutation. What is nonsense mutation? If a codon coding for an amino acid is replaced by a stop codon, and if there is premature termination of protein synthesis, and if a truncated protein is produced, then that is called as nonsense mutation. So here the answer is nonsense mutation. Okay. Which of the following proteins is used in DNA packaging? It's a very simple question. I'm very sure all of you would have answered it right. DNA packaging, which protein helps? It is histones. Yeah, DNA packaging is helped by histones. Because in your cell you have chromosomes. Every chromosome is a long double-stranded DNA. If you just have a long double-stranded DNA, it will measure a few meters long, which you cannot pack within a nucleus of few microns in diameter. Do you all understand this? All chromosomes, every chromosome is one long double-stranded DNA which measures a few meters long, which cannot be packed inside a nucleus of few microns in diameter. So you have to condense it. To condense it, we use histones, which are basic proteins which are positively charged. Okay, your DNA is negatively charged. So when you allow histones to come and sit on the double-stranded DNA, a segment of double-stranded DNA will get wound around histone, and that gives compactness. So packaging of chromosome is predominantly done by histones. It's not only done by histones. Okay. Yeah, in all revision sessions we discussed. Yes, Shruzana, I'm happy that you remember all of that. And this acid-base disorder question we must have discussed 100 times, right? So identify the acid-base disorder in a patient with the following values. So let's try to exclude all these choices. pH is 7.2. What is the normal pH? Normal pH is 7.36 to 7.44. In this case, what has happened to the pH? pH has reduced. So yes, it is respiratory acidosis. Excellent, Shruzana. So pH has reduced. If pH is reduced, we know it is acidosis. Just because it is acidosis, what are the 2 choices you can exclude straight away? You can exclude choice C and choice A. Yeah, it is neither respiratory alkalosis nor metabolic alkalosis. And then to find out whether it is respiratory or metabolic condition, you look at PCO2, you look at bicarbonate. What is a normal PCO2? The normal PCO2 is you take off the 7. Yeah, so normal PCO2 is 36 to 44 millimeters of mercury. And in this condition, PCO2 is elevated. So what is it? If PCO2 is elevated, can it cause acidosis? Yes, right? Because carbon dioxide is a source of acid. So if carbon dioxide accumulation is the cause of acidosis, what will you call it as? You will call it as respiratory acidosis. So what is the right answer here? The right answer here is respiratory acidosis. So how did I exclude metabolic acidosis? Had it been metabolic acidosis, bicarbonate should have been low. Okay, so this is respiratory acidosis. Now, which of the following disorders follows autosomal recessive pattern of inheritance? Yeah, we have learnt about cystic fibrosis so many times. Cystic fibrosis is autosomal recessive. Okay, so other than cystic fibrosis, if you look at achondroplasia, Huntington's, Treacher Collins syndrome, all those are autosomal dominant conditions. Which of the following helps in transporting fatty acids across inner mitochondrial membrane for them to be utilized in mitochondria? So this we have discussed so many times. To take fatty acids across inner mitochondrial membrane, you need a carrier, and that carrier is carnitine. Yeah, and that carrier is carnitine, and that is why I told you carnitine acyl transferase 1 is the rate limiting enzyme of fatty acid oxidation. Okay, answer is carnitine. It is not LCAT. Yeah, what is LCAT? LCAT is lecithin cholesterol acyl transferase, which converts cholesterol to cholesterol ester. Thereby it converts discoidal HDL to spheroidal HDL3. So LCAT has got nothing to do with transporting fatty acids into mitochondria. LCAT is responsible for HDL metabolism, where it converts discoidal HDL to spheroidal HDL. And what is the function of acyl carrier protein? Acyl carrier protein helps in carrying the fatty acid. Yeah, it helps in carrying the fatty acid, and it's a part of fatty acid synthase complex. Do you all understand this? Acyl carrier protein is a part of fatty acid synthase complex when fatty acid is getting synthesized, and synthesis happens in cytoplasm. Okay, it has got nothing to do with mitochondria. So what is the right answer? No problems, Rosanna. 1 or 2 questions you will make, you will commit mistakes even if you know the right answer. So you don't have to get demotivated or demoralized. Yeah, this is normal. Okay, so the answer is carnitine. Which of the following is a complex 4 inhibitor? So electron transport chain inhibitors we have discussed so many times. Complex 4 is cytochrome A and A3, and from complex 4 electrons go to oxygen. And electron transport between complex 4 and oxygen is inhibited by common poisons including hydrogen sulfide, cyanide and carbon monoxide. Yes, hydrogen sulfide, cyanide and carbon monoxide. So what is the right answer? Complex 4 inhibitor is cyanide. Yeah, it is not carbon dioxide, it is carbon monoxide which inhibits complex 4. And how about BAL and antimycin? BAL and antimycin are inhibitors of complex 3. They are inhibitors of complex 3. So answer is cyanide. That is why cyanide causes which type of hypoxia? Cyanide causes histotoxic hypoxia, because how much ever oxygen is available, tissues will not accept any oxygen. So all these electron transport chain inhibitors will act as a mechanism of histotoxic hypoxia. And this I discussed in one of the physiology special classes. The mechanism of action of botulinum toxin is, do you remember this? The mechanism of action of botulinum toxin is, so both tetanospasmin, oligomycin. Okay, so if one of the options was oligomycin, oligomycin is an ATP synthase inhibitor. It inhibits complex 5. Yeah, oligomycin inhibits complex 5. You're too good. In the last one I watched many videos. Thank you. Yeah, I'm happy, Milind. I'm happy that it helped you. Yes, oxygen therapy helps. Okay, yeah. So this is botulinum and tetanospasmin. What do? Both these toxins inhibit with the docking step. They inhibit with docking step and they inhibit neurotransmitter release from lower motor neuron endings. So both inhibit acetyl choline, not tetanospasmin, botulinum toxin. So what is the difference between botulinum toxin and tetanospasmin? Botulinum causes descending type of flaccid paralysis. Don't we know that? Yeah, botulinum toxin causes descending type of flaccid paralysis, whereas tetanospasmin inhibits spastic paralysis. Any idea when NEET 2023 January, how will interns attend? Let's discuss about that later. Yeah, so botulinum causes flaccid paralysis, tetanospasmin causes spastic paralysis, but both interfere with inhibiting neurotransmitter release. So this is lower motor neuron, and you know lower motor neuron normally releases acetyl choline and upper motor neuron releases GABA. So what does botulinum do? Botulinum gets into the nervous system through lower motor neuron endings, and from lower motor neuron what is not released? Acetyl choline is not released. Without acetyl choline, no contraction. So that causes flaccid paralysis. Okay, whereas here tetanospasmin inhibits GABA release. Shakti, I don't want to be in a hurry. I am always into conceptual learning. Yeah, so try to understand, because any day learning a fact or concept would help you. Okay, so if you can be patient, I will go to the next session, next question in another 1 minute. Okay, so tetanospasmin inhibits GABA release. When GABA is not released, lower motor neuron will be hyperactive, so that causes spastic paralysis. So this was also discussed, right? True about telomeres or telomerase. Okay, So what have I told you about telomeres or telomerase? What is the right answer? Inhibits presynaptic release of acetylcholine. No, it does not cause. So maybe they refer to, does it inhibit acetylcholine release from upper motor neuron ending? It inhibits acetylcholine release from lower motor neuron ending. Okay. So with telomerase, what is the right answer? With aging, there is shortening of telomeres. With aging, there is shortening of telomeres. Okay, so after every replication and after cell division, the telomeric end will get progressively shortened. Okay, after every cell division, telomeric end will get progressively shortened, and this nature knows, and that is why telomeres are provided with completely non-coding sequences. Okay, and that is why even if telomeric ends are getting shortened, we do not present with any defects or mutations. But there is a critical or minimum length of telomere that is necessary. Yeah, there is a critical or minimum length of telomere that is necessary for you to maintain the stability of your chromosome. So when you are born, you will be born with a particular telomeric length. And as you push your cells into cell cycle, this telomeric length will get progressively shortened. And once the telomeric end has reached a critical length of telomere, you will stop sending the cells into cell cycle. And when you stop sending cells into cell cycle, that causes aging and that causes death. Okay, so as aging progresses, because somatic cells do not have telomerase enzyme, they cannot replenish telomeric ends. So in somatic cells, telomeric ends will get progressively shortened. Is that clear? Okay. Oh, you read about progeria and you found it. Good. So with aging, there is shortening of telomere, increases with increase in age. I have given that as choice B. That is not true. With aging, there is shortening of telomeric length. Okay. So this was also discussed in one of the special classes in physiology. What will happen when the thermostat set point is shifted to the point that is marked in the blue dashed line? Did you all answer this question? So we know our thermostat is present in hypothalamus, and the function of this thermostat is to fix the temperature at which the body is going to function. And usually the thermostat in hypothalamus sets the temperature as 98.6 degrees, close to 98.6 degree. So whenever the body's temperature rises above 98.6 degree, what will the body do? The body will switch on heat dissipating mechanisms. And if the body temperature falls below 98.6 degree, what will the body do? It will switch on heat generating mechanism, so that we always maintain our body temperature around what temperature? 98.6 degree. So many of you are giving me right answers. I will tell you first, the right answer is shivering. Yeah, the right answer is shivering. So this is what thermostat in hypothalamus does. Now, if there are endotoxins, which enter into the body, these endotoxins can reset the thermostat to higher temperature or lower temperature. And they are asking you, this is the new set point. They are asking you what will happen if an endotoxin sets it at a higher temperature around 103 degree. If the body temperature has to be set at higher temperature, what will the body do? The body will switch on heat generating mechanisms. And out of these, which is the heat generating mechanisms? Yes, I made a video on carbohydrates. I made a video on all topics. Okay. So heat generating mechanisms. Of these, which is the heat generating mechanism? It is shivering. Right. Because in shivering, when skeletal muscle works, heat is getting generated. So if it's an endotoxin which sets the thermostat at a higher temperature, then the person will shiver. Okay. So what happens if a person sweats? It is exactly opposite, right? If a person sweats, because of evaporation, the body temperature will be reduced. You don't want that. Skin capillary dilatation, because of conduction, heat will happen. You're the best teacher. Just one day before I saw your videos, I didn't study till now. Oh, thanks. I'm happy, Shakti. Such a sudden shift in temperature, I thought heat shock, shivering won't happen. Sweating happens when the thermostat is set at a lower temperature. Yeah, if the thermostat is set at a lower temperature, the body will try to keep the body temperature lower. How can you keep the body temperature lower? By conducting the heat or by evaporating. So for evaporation, there will be sweating. For conduction, there will be vasodilatation. Okay, and you will stop all thermogenesis, all forms of thermogenesis. Chemical thermogenesis is nothing but epinephrine induced muscle contraction. Is that clear? So that is inhibited. All other will cool the body. This is the only one which increases the body temperature. So shivering is the right answer. Okay. So these are the 17 questions which I could pull as far as biochemistry and physiology are concerned. Physiology, there were few questions, but I didn't discuss those because these are the questions which I thought you will need guidance on. Okay, so if you have any doubts, you can type those doubts in the Telegram group or here. I will later come back and explain you. Okay, so thank you all the best. So for now, forget about how you wrote the exam. For now, forget about the key, forget about the rank. So have a good time for some time, and then we can come back and worry about the rank. Okay, and I'm very sure those who are prepared consistently will definitely get a good rank irrespective of what you now feel about the exam. Okay, so thank you all. My pleasure, Sakshi. My pleasure. See you all. You will get Shakti. You will get. My best wishes.